addicted to? And what did this world do to you? What'll it take to get you through? And how long has this had a hold on you?
Hello, and welcome back. We got the second part of Joanne coming back to Addicted2, so we're going to continue on with our conversation. Welcome back.
Thanks.
So I guess something else I wanted to know, I guess a lot of people would be wondering, would be how you were able to make peace with all that, and the fact that you are accepting the fact that you just want to go out sober, which is unbelievable, because most people would say, I've got a reason and fuck it, I'm going to do it. And, whatever your drug of choice is, they'd be like, yeah, I don't have anything to lose. But you do have things to lose, because you still hold dearly your relationships. You've got your kids.
Yeah.
So is that part of the reason too? You don't want your kids to see you, like, to have memories?
This honestly has, like I said, it has nothing to do with anybody else. I chose to be selfish in this part, that because even my best friend, she doesn't want me to do this. She's like, I don't want you to go,
Well, nobody does.
Right.
Nobody does.
So I had to, I've got to do when I chose to do the surgery, because I did, I went up to Foothills and went through the consultations with the oncologist. Met with the radiologist, oncologist, and the surgical oncologist, and I went through everything, like seeing what their plan was going to be for me. And of course, then, because the surgery was so far out, it gave me enough time. I'm in a few Facebook support groups, and so it gave me enough time to go in and look and see, what are they going to do? What is this going to look like, and what am I going to be feeling? And it's not stuff I want to go through. You won't see any tattoos or anything on me, because I'm afraid of pain. Not afraid of pain, I don't like pain. And I think it's because I always have so much pain that to give me more, no thank you. I don't want it. And yeah, like my kids, Kayla, I'm still having a bit of a struggle with. We're not sure how that's going to go, because they do have really good family supports. So while I'm waiting, I'm just in the process of waiting to get into hospice. But as soon as I get into hospice, there's going to be lots of care there for my family. It's my family that needs the support more than I do. Like, I already know what I want, and it's going to hurt a lot of people. But my family are the ones that I get upset about. That makes me go, well, I don't want to upset them, but in the same time, I've got to do this for me. And at first, when I had said yes to the surgery, it was for everybody else. Everybody was, you can fight this. And I remember my daughter even saying, Mom, you can even be a model after. And I'm like, still not, it's not about that. Like, vein-wise, it had nothing to do with that. Like, I'm like, chop it off, I don't care, right? But it's just the pain and knowing that I'm going to wake up the next day and there's still no cure for fibromyalgia. And until there's cure for that, I'm going to still, because I went through bouts of, I did a full 3 months at the, the old children's hospital. It was a 2-year program that I did for chronic pain. And I did everything, and I'm on everything. And now Calgary has a specific fibromyalgia doctor, and that's all he does is strictly fibromyalgia. And it was a 7-day Zoom course that I did with him. And everything he's talking about is everything I'm doing. Like the pacing. The only thing that I wasn't doing right was that I would go into an activity, go hard, right? Like just give it my all, and then I'd be down for days. But he taught us that you should be resting before. So when you have a big day coming up, you rest before. then you do your event, and then you rest again after. Then you do your event. So I was doing the event, rest, event, rest. So I always felt like I was behind, right? And that's made a huge difference to that. But those flares, like they're until there's a cure. And I'm on the top medication that I can be on for that, and I'm still stuck in my bed. Like I didn't know it was progressive until this year. At the beginning of this year, I realized how progressive the fibromyalgia is. And now with the cancer, it's gone even more. Like it's just...
Oh, is that right?
Yeah. And the doctors warned me that would happen, because I'm like, why is this? It's not going away, right? Like, but yeah, the pain's been like a 10 out of 10 almost all the time. So
they were never able to get on top of it?
No.
Because I remember before... we could go out for ice cream and stuff, and then you'd say, I can't, I'm stuck in bed.
Yeah, yeah, and they only came, but it wasn't all the time. It was, I would go through periods of time where I was good, and I could actually go out and do things, going to like roundups and stuff like that. I had no problem, we went to the Bragg Creek, where it's not the most comfortable sleeping, but had no problems. And, just attending meetings was no problem. Being able to say that I could meet somebody for a coffee was never a problem. And like this year, I've had to I had my birthday that came up April 5th, and my friend had a fire and she bought a nice cake, and I had to cancel. And then Mike's birthday, his 50th birthday, I arranged a surprise party for him, and I didn't even show up. I couldn't show up because I couldn't get out of bed, and I had to call him. He was actually at a wake that day for a friend, and I had to call him and tell him to get to the location because all of his friends were waiting there, so like that gets old really quick. And I'd say I've been dealing with it for 20 plus years now. So
has it been that long?
Yeah. So, and and then just looking at other things, like knowing that, like I went from short-term disability to my long-term disability it's been approved as well. So I could, money's not even an issue, because I had really good insurance at work, and for what they're going to give me for the rest of my life, like I could have lived comfortably on that, and yeah, it's nothing, it's just knowing that I'm going to wake up still in that pain. And, my daughter, she says, we'll come visit you. And, in the last 3 months, I've seen her 1 day or 2 days, right? So,
Well, it's hard, eh?
Yeah.
I mean, it's hard on everybody. You've made up your mind, and that's why I wanted to ask that question, because I know that's what my ex was in, chronic pain.
Yeah.
And she used to be, she actually worked for EMS.
Yeah.
And then, we had discussions. I'd be like, I want to, go to the island or do. And she sat me down and said, you know what? I can't describe what it's like to you. Like she says, when you're not feeling well, you want to be home.
Yeah.
She said, that's what it's like for me all the time.
Yeah.
And when you're in pain all the time,
yeah.
She said, you know what? A lot of people are, suicidal.
Yeah.
Because it never goes away.
Exactly.
So after a while, it's just so tiring.
And it crossed my mind, I can tell you, probably over the last 2 years, so many times. But I also didn't want my family to find me like that, or anybody for that matter. Like, I just know if there's this other way that I can go that's humane to, not traumatize people. That's what I want to do. I don't want to cause trauma to people, right?
No.
So I was suicidal, like quite lots of suicidal ideation, but it wasn't something that I felt I could go through on because of other people finding me or me not doing it right. And then, I say my luck, I'd become a paraplegic, and then then they got to look after me more, right? So.
Well, just to put things in perspective too, you are here,
yeah,
and you're very lucid, but you were in so much pain. You are on a fentanyl patch right now.
Yeah,
and
I'm on a lot of meth.
And it doesn't even faze you.
No. I'm actually on a lot of medication.
And you're on morphine.
Yeah. Yeah.
And
then we've also got, they just put in a port, oh my God, what is it called, Mike? Subcutaneous line, where he puts needles of the morphine straight in. It's, instead of going into the vein, it goes into the fat, in through the tissue, and then goes into the body. I don't know what the difference. It's something that they're allowed to leave in at home, that instead of, because over the last 2 weeks, I've had a visit to Rocky View because they thought I had a I can't even say it.
pulmonary?
Yeah, embolism or a heart attack. That's what they thought. So they brought me into the hospital, found out that the tumor's growing and it's pushing up against my heart. So I'm like, okay, so that's what that pain is. So they got my pain level under control. And 2 nights later, the pain is there again, and I can't get with what I've got at home. Like, I have a lot of medications, nothing's bringing this down. So I call into, because they've got me on palliative care at home. They came in and put a hospital bed in my house. They put bath rails, like, to hold on, like, I don't know what you would call it, but those bars in the shower. They brought in a chair that I could sit in the tub. I now use a walker if I have to walk any length of distance, and there's a fancy dancy wheelchair on its way to me somewhere. But this is stuff like, it's stuff that, yeah, I want to go into palliative care, because I just find this, having to wake Mike up at 4:30 this morning to do this needle. It's like, if you're in a hospice, that's what the nurses are for. They're getting paid to be up on these 12-hour shifts and they're awake, right? Whereas, we can't go on like this for very long, because they're not, he's going to, him and my mom, like, it's stressful. My mom, she started to cry when they came in and said that she had to do it. She's like, I don't want, I'm scared, Even when they put the first fentanyl patch on me, it got stuck to Mike's fingers, because when he had the rubber gloves on, and he's a burn survivor and he's missing half of his fingers. So obviously those fingers with the no fingers in the gloves, those are the ones that this thing got stuck to. And then it got stuck to that. And I'm like, okay, that's it. You're fired. And so he's like, oh, so I went from, I forget what it was, RN to a rotten nurse or something. Like, he was just making a joke, right? But, yeah, it's a lot. Like, it's a lot of medications, trying to remember. My short-term memory is gone completely, so I won't even remember tomorrow that I was here.
Is that right?
It's shot.
And the whole thing is, because, I think like an addict, and most people do, where I mean the people that are listening to this broadcast, so you are going to be on these powerful drugs, but you can't even enjoy them. It's not giving you the pain relief. So when you do finally go in, I would is it going to be very long?
I'm hoping not.
Did you set a date?
Not yet, because I've got one approved. I've got to have 2 physician approvals. So I've got one so far, and my family doctor was supposed to do the second one, and she just got a hold of them on Thursday and let them know that she didn't feel comfortable doing this. So
she doesn't?
No.
Why?
And I think because I've been her patient for so long. That's the only thing I can think of. But the thing that pissed me off was, okay, if you didn't want to do it, like, you wasted a week.
Well, exactly. Because it's your decision.
Yeah. No, she's okay with that. She's just not okay with her doing it to me. Yeah. So I wish she had said something a week earlier, like when she was asked to do it. I wish at that time she said no. She could have said no, please find somebody else, and we would have. Because now this has got thrown off by another week of having to wait. But we do have a doctor coming on Monday at 10. And once that goes, I don't even know if I'll end up in hospice.
Well, I can see the point, and I'll tell you why. Because when you text me back, and, me and Spud went to see you, and there was a lot of people coming, and I honestly thought that was going to be the last time I ever saw you.
Yeah.
And, I was very emotional. And then when you reached out to do this, I thought, wow,
I just think it's important. It's important that there's never, like my dad passed away in 2020, and that's one of the things that I thought, because as an addict, the brain always goes, when would I drink again? What would make me drink? What?
Exactly.
There's nothing, I had my house burnt down. I didn't drink over it. My dad died. I didn't drink over it. All those excuses that we can tell ourselves, and they are excuses. Having this is just the same. It's not something that I want to drink over or can drink over. So, yeah, I think it's important.
But this is a whole different level for most people to wrap their brain around.
Yeah.
Right?
Yeah.
So it's so powerful to be able to put it out there and to be able to say that you're going to face this your way.
Yeah.
With dignity.
Yeah.
And to be quite honest, if you did fall off the wagon, it wouldn't look any prettier.
No. And I'm sure my tolerance is.
And I wonder if it would bring up resentments and different emotions. I mean, thank God you'll never know, but I can't imagine that you would come out of it the same way you went in.
No.
And
that scares me.
Exactly, because that's the part that no one thinks about. As an addict, we're just thinking
the good times.
Like I've thought about it in my mind. If it was me, I can see myself, and I'd lay out some blow, and I'd start at one end of the table. But that's not thinking the other things through.
Right.
Like you said, like your family, your family walking in and seeing you, because we isolated and we did things alone.
Yeah.
And most of the part is because being drunk and stoned is not pretty.
No.
We don't look very nice.
Like, I couldn't imagine hurting somebody and that's the last time they get to see me. I hurt them. There's no time to make amends if you're dying. You do this and
you would probably at some point be belligerent.
Yeah.
Because that's what we get.
Yeah.
And you would probably have a lot of mixed emotions.
For sure. The only thing I can say too about the hard drugs, I will say this, that I get them and I need them for the pain, but it cuts off that contact with God for me, and it always has.
It does?
Yeah. So even having fibromyalgia, and I've had to take Percocet, I've had to take Tylenol 3s, but when you get into fentanyl, I've never tasted. That was one of the things they were afraid of the fentanyl, and we had to call an ambulance because I'm crying in pain. And somebody told them, well, all they do, they see what they see, and they're told it's fentanyl. And so my mom's like, be careful. They have rubber gloves and plastic bags to put them in. And so one paramedic went up to my mom and he said, that's not the same fentanyl that they're doing on the street. Oh. And so he explained to her how these work versus what they're getting on the street. And she felt a lot more comfortable, right? Like, she was scared. I'm like, no, you're not going to. She was afraid, I think, that she was going to walk in and I'm going to be bottlenecked in the room, right? So I'm like, you're not going to see that, Mom. Like, it's different, right? And so I do have, I take it when I'm in pain. And it's not to abuse it, because I actually don't like when I take the morphine, because they did it once in the hospital and they gave me one part too soon, and I don't like that feeling. I was a beer girl. I didn't even like heavy liquor, or hard liquor. I couldn't even drink. So, Can
you just explain, when you say that it cuts you off from God, what do you mean by that?
I don't get those. I don't feel those God shots. I don't notice them. I'm not
Do you feel
present.
Disconnected?
Yeah, and I don't feel present. And I don't feel because I can see things when I'm sober all the time. I know this morning I got out of the shower and I walked out of the bathroom and there was a dime on the floor, and dimes for me mean something. that's something spiritual for me, that I feel it's a loved one reaching out. I also have lights, and I've had this for years, where it used to be in my closet. Anytime I was talking spiritual about something, a light in my closet used to start flashing. And I thought, okay, the bulb's going to go, right? It never went in like 3 years that I lived there. And it would just stop. And then a month later or 2 months later, I'd be talking to somebody and it would start flickering. And so we went out to, where is it, Lake Louise, to the Chateau Lake Louise.
Right.
And I opened up the cupboard door and lights are on in there and it starts flashing. And I'm going, oh my God, there's a ghost in our room. And they say that place is haunted. And I'm like, this is cool, but okay, go away now, you know.
Go away now.
And yeah, so I just see that. And even like in August, we went to Red Lobster for my dad's birthday. He passed in July of 2020. And as soon as we got seated, I looked down at the end of the row of seats, and there was one light, and it just started flashing. And only, like, it was shimmering, and you had to watch it for a minute, and then you'd see it. It would just go for a minute, and it would stop. And then it would go for a minute, and it would stop. And I'm like, how do you, there's no way to explain this stuff, right? And I just take it. That's my belief, you know, that's either, you know, I look at it as my dad or God, somebody sending me a message. That day, I think it was my dad. I'm here, now enjoy that lobster, right? So, but I don't get that. I don't see those things when I'm high. I'll say high because they do make me high. And
When you get a certain amount.
Yeah.
Well, but it is for the pain management.
Yeah.
Nobody could fault you for that.
No,
because,
I have to take that. Like and not taking it, like my mom, like I'll sit there this morning, for example, when, you know, he's changing putting the needle in, or just when it's time to change the patch, like I'm just, because it's a 3-day patch, by the time that 3rd day comes, like I'm in wicked pain. And it's not nice to look at. It's not nice to see your loved one going through that pain, knowing that they can't do anything for me.
And you couldn't, again, like when it starts running out on the 2nd day, you don't think, rip the strip off the other one, and that's
no,
really
no, I've never see. And that's the thing, knowing my character defects, I guess, or the way I am. I have the same doctor that I've had in her office. There's 2 other doctors that delivered both my children. They still work at that office. And I've had the same doctor for 12 or 13 years. She knows my whole history. We do my prescriptions every 3 months so that I never get off track. Like, everything's taken, because I take sleeping pills. I've been on those for 12 years, because with fibromyalgia, you don't go into REM sleep. And you need that, you know. And then just the other ones, there's not really any point to, you know, you could abuse. There's other ones like Percocet have been there for as needed, but I've never, like, I'll go back to her in 3 months and I still have 2 refills left, right? So from the last time.
They don't do much?
They do for the fibro, not as much. I've had to actually, I switched over it's got to be about 4 or 5 years ago. For fibro pain, I've used a THC edible, and it's one brand that I found that takes the fibro pain away for about 3 to 4 hours. And so
another friend of mine was actually using what is it that they give addicts to come off of?
Methadone.
Methadone.
Yes, they asked me this week, so now when I have pain, and like I've got these needles that we can inject. There's not even a needle on them anymore. The needle's in my arm, but they asked me if I've been on. Yeah, they asked me if I took methadone before. They were actually going to try me on that or ketamine, which is like, I thought was like a horse tranquilizer. And I'm like, no, I haven't tried any of that. But when I'm in pain that I can't, when it gets past what I can control, I have to call our palliative care number, and then they call EMS, and the ambulance comes out, and they end up doing all the IV medications. So they came out last Tuesday and did 3 rounds of morphine, and then 2 rounds of fentanyl. And this was all through IV, which are totally different than when you take them by mouth versus going right into the bloodstream.
So you are such an addict. Because you just finished telling me that you won't remember this conversation, but you can remember when they came back to give you your drugs on Tuesday.
Yeah, but I can't tell you what time I woke up this morning. I can't tell you what I ate.
I just wanted to make a bit of a joke on it because, you had no problem recalling that at all.
But you know what else? It might not have been Tuesday. I can't remember what date it was. And I think I always say last week, I think it was Tuesday. It's just one of those dates. Yeah. That it could have been. I know that I went in an ambulance on a Sunday because nothing was open. All of the diagnostic imaging, it was slowed down because they didn't have enough staff because it was still on a Sunday, right? The worst time to go to emergency is on a weekend because there's no doctors or technicians, right?
I don't think there's many during the week either.
No, I know, it's sad. Our medical system. I gotta say though, this last time they were fabulous with me. And even with my mom, she had to have a procedure done and she couldn't get it done because she had to come here as soon as I got diagnosed. And so she kept putting it off, bumping it off for another month. And she went down to urgent care and they were able to get her into Peter Lougheed on Tuesday to have, it was a stint that they had put in because she had gallbladder surgery last December and it went, she had complications from it, and then they ended up having to put a stint in from her, from her liver to her lower bowel, and she got it put in February, and she was supposed to have it out July 31st, and now it's September, and it's still in there, and it was bothering her, and they took it out, put her out, took it out, and now the other good thing is she was supposed to fly from here to St. John's, have the procedure, and then drive on the bus for 10 hours back to Corner Brook. So now she can fly from here, and she can go straight to Corner Brook. She can fly into Deer Lake straight from here. So it really works. So our medical system, as much as I want to give them hell, they have their good points too. I think.
And the thing that kind of makes me laugh is that she's going to fly to St. John's, but she's not going to stop at Stephenville.
No, she's close to Stephenville. She can drive there.
Because that's kind of one of our inside jokes.
Yeah. Yeah.
Well, it's just amazing how, you're just going through this, accepting it all.
Yeah. Yeah, it's got to be better than this. This vessel needs to be shut down. It's the body, it's broken. So now, and the mind, I was just going to start, there's some Tai Chi that was going on at a park near my house. And so I was just going to start looking into that and trying to work on, the mind and trying to be healthy. And when that radiologist, when I seen her look on her face, I just knew, but nobody's ready to hear. I honestly did not think I had cancer. I was doing like the heavy detox metal baths. I was doing parasite cleanses, everything, to try to stay healthy. And that there's still nothing prepares you, because I went out to Mike. He was out in the car and I'm like, I'm full of it. He's like, what? I said, yeah, I've got breast cancer. And now, even from July to now, it's like my breast is twice the size, if not 3 times the size it was then.
Oh, and that's the tumor.
Yeah. Yeah. They said, at first I thought I felt one in the armpit, and then I thought there was 2 on the breast. And I said, how many are there? She said, Joanne, they stopped counting. There was too many. So the lymph nodes are full. So they would have had to cut all of those out.
I didn't realize that either. Mm-hmm. So it actually does, it makes sense, the increase in size.
Yeah. Oh, yeah. They said that normally when they catch them, they're at 0.5 millimeters, and some of mine are up to 5 centimeters. So
wow.
That's, quite big.
In that short a time?
Yeah.
Just from June?
Yeah. I would say April. I would say it was more around April is when I think they started.
Oh.
Yeah, just based on the x-ray that I had in April, that nothing You know, so between April, May, around May-ish, I'd say they started. So to go to stage 4, I'm like, I said, I have a very powerful God. Don't mess with him, because when I prayed to die, he listened.
Wow.
Yeah. Yeah.
Yeah, I mean, a lot of people probably couldn't really understand that.
Yeah.
And I'm sure that's why your daughter's having a hard time accepting that.
Yeah. Well, she's scared, right? She's losing her mom, and I don't blame her. You know, I would be the same way. I think I'd be with my mom more than she has. I think one day it's sad that she might regret the time that she's not spending with me right now, and the same as my son, but they have their lives, and, you know.
You know, it's funny. I remember, because I don't deal with these things very well either. And I remember talking, I think, to a priest one time. And, you know, I said, like, what do you even say? And he just looked at me and says, just say I'm sorry. Mm-hmm. That's it. Like, because, I mean, you know, obviously they deal with weddings and end of life all the time. Mm-hmm. And that's all he said. That's all you have to say.
Yeah.
But people grieve in different ways.
Yeah.
And acceptance doesn't always look the same for everybody.
Right.
And so I don't know. She's dealing with things the best way she knows how, and maybe it's avoidance, and maybe she's got a little of us in her too.
Yeah.
Because, you know, one thing we like to do is avoid things, right?
For sure.
Because we think that it's less painful.
If we don't look.
even though the pain's still there.
Yeah. Or go get drunk.
It's hard to be that close to it.
Yeah. Yeah.
So, you know, I don't think that makes it any easier, but everybody's got to go their own road.
Yeah. Yeah.
Well, I guess we're out of time, but I'm sure glad you came.
Yes, thank you for having me.
And I will come and see you if there's a chance.
Yeah, and you bring that Dairy Queen ice cream.
I will.
I'm holding you to that.
What do you want?
Oh, just a cone.
Just a cone.
Just a cone.
Okay. I can make that happen. I'm a fridge mechanic. If I can't keep a little bit of Dairy Queen from melting, then I should give up this trait. So you got a deal.
Perfect.
We're going to do it.
All right. Well, thanks, Sean.
Okay. God bless you.
You too.